Diabetes encompasses a group of disorders marked by elevated levels of blood glucose, often called blood sugar. Excessive blood sugar can lead to severe and potentially life-threatening health complications. There are two main types of chronic diabetes, type 1 and type 2. Pregnant women can develop a temporary form of the disease known as gestational diabetes, which typically resolves after childbirth. Prediabetes occurs when blood sugar levels are higher than normal but not high enough to be classified as diabetes. Prediabetes doesn't always progress to full-blown diabetes. When we digest food, carbohydrates are broken down into glucose, which is then transported through the bloodstream to various parts of the body. Insulin, a hormone made by the pancreas's beta cells, is essential for allowing glucose to enter target cells. In healthy individuals, insulin produced by the beta cells binds to receptors on the cells, enabling them to take in glucose. In type 1 diabetes, the immune system mistakenly destroys the pancreas's beta cells. The exact cause of this is unclear, but genetic factors are thought to play a significant role. As a result, insulin production decreases, fewer insulin molecules bind to cell receptors, and less glucose enters the cells, leaving more glucose in the bloodstream. Type 1 diabetes typically develops early, with symptoms often appearing suddenly and before the age of 20. It is primarily managed through insulin injections. This makes individuals with type 1 diabetes insulin dependent. On the other hand, in type 2 diabetes, the pancreas produces sufficient insulin, but the cells fail to respond effectively. Either the receptors don't bind properly, or the insulin signaling inside the cells is disrupted. Consequently, glucose remains in the bloodstream. Type 2 diabetes is often referred to as insulin resistance. Once again, genetic predisposition plays a role, but lifestyle factors are thought to significantly influence the development of type 2 diabetes. Obesity, a sedentary lifestyle, and an unhealthy diet are common risk factors. Type 2 diabetes usually develops in adults, with symptoms emerging gradually, typically after age 30. It accounts for 80 to 90% of all diabetes cases. Management of type 2 diabetes focuses on achieving weight loss and often includes a low-carbohydrate diet. Don't forget to like, subscribe to We Care YouTube channel, and hit the bell icon to stay updated.